Hello, friends. A very good evening to all of you all. Hope all are doing great, and I wish the Almighty to keep all of you all safe and secure. I'm your host, Dr. Swapnil Nagwekar, founder of Dr. Swapnil's Health Arc, a gut health expert and health educator and motivator. On this Health Arc platform, my mission is to provide the best educational platform in terms of medical field by inviting reputed doctors to share their valuable insights and to create awareness among people in terms of our health. And my mission is sharing is caring. And I believe sharing medical knowledge is a top priority for me. We started with the series of COVID lectures. And my mission was that people should get the right information and there shouldn't be any misinformation and myths. So we started first with the vaccination first session, which was held with Dr. Nishi Singh. All the myths in regards to vaccination were eliminated. Second lecture, we had a COVID care in home isolation, where we invited Dr. Amit from Thane. And we had an awesome response for both this session. Now, today's session is very, very important. You have to ask me why. So you have to ask in the comment box why this session is important. The session is important because in the first session, I would say the first wave, which was in 2019, 2020, when COVID struck worldwide, it affected the elderly age group. And later on, the present second wave is affecting young and middle age group. This virus, which is there now, it's a mutant virus. It's a very virulent virus and very infectious. Now, most of the people are getting infected and also getting also immunized. So probably there might be immunity in this age group. But some virologists, some experts are saying there might be a third wave. And this third wave, they're predicting that it might affect the kids. So in this regards, it becomes very, very crucial that we need to protect our kids. We need to be aware and we need to educate ourselves in regards to our pediatric care. So it is, I would say it is not just about infection in kids, but there is a universal crisis and impact which will be lifelong. And I will just share some data about UNICEF. They're saying that school for more than 168 million children globally has been completely closed for almost an entire year. According to those studies, they also said 463 million children globally were unable to access remote learning during the COVID-19 school closures in 2020. Secondly, there was also a study conducted by the Johns Hopkins School of Public Health in 118 low and medium income countries, where they anticipate that over 2 million additional children will be dying because of COVID-19 in the next 12 months. Due to COVID-19, 80 million children under age of 1 year in 68 countries may miss out on receiving life-saving vaccines. So it is not just about infection. It will create a massive impact on the child health. So in this regards, this topic becomes very, very relevant. And today's session will be covering what precautions we need to take in terms of our COVID-19 care, what to expect in the third wave, how to monitor your child, and very practical questions will be solved in this session. And it's my privilege to invite a well-known name in the field of pediatrics, Dr. Barnali Bhattacharya. Dr. Barnali ma'am is a consultant pediatrician and asthma specialist in Children's Clinic, Pune, with special interest in pediatric pulmonology. Dr. Barnali ma'am is graduated from prestigious Armed Forces Medical College. She is a diploma in child health from University of London. She is a gold medalist in MD Pediatrics from University of Delhi. She has completed a fellowship in tropical medicine from University of London. She is specially trained in pediatric asthma in Great Ormond Street Hospital for sick children. She has served a short service commission in the Indian Army. She is an integral part of many modules of the Indian Academy and Pediatrician. She is a course director of two programs for pediatrics for asthma and Casper Clinic. She is a faculty at national and international conferences. She has published scientific articles in peer-reviewed journals and written chapters in textbooks. So please help me in inviting Dr. Bernali Vittacharya ma'am on this international platform. And I want all the viewers there to write in the chat box, welcome Dr. Bernali ma'am. So I would like to invite all of you. And thank you ma'am for joining for this session.
Thank you so much, Dr. Swapnil, for inviting me on your exciting chat. And I would like to tell all your viewers that I'm delighted to be with all of you here this evening to share information and also to allay your anxiety, to dispel your doubts, and talk about children and COVID 19.
Yeah. Yeah, a lot of people are saying, give the Ankush, Sulba saying, welcome, ma'am, welcome, ma'am. Thank you for
Thank
your
you.
messages. It is so good to see all your messages. Ma'am, I would say before I start, I would request all the viewers, see, whatever information we'll be sharing now, like you, this information is very crucial for each and every families because we need to protect our kids. So this information which we'll be sharing, I want also to share on your Facebook page or Facebook profile this link because there will be so many people who wants this information, and whatever ma'am will be telling the information will be a absolute practical information. She has a very experience in all these aspects and she is handling the COVID kids also. So I want all of you all who are joined there to please share on your Facebook page or a profile this live link so a lot of people can get information and they can be aware of this situation. Ma'am, before starting with this, COVID has created a massive impact for the worldwide,
True.
and the impact on kids is more if you compare, if you look at it. So, ma'am, how different is the pediatric COVID from the adults?
As far as the disease goes, Swapnil, a lot of children remain asymptomatic. And that is what makes it more dangerous for the community because without knowing they are the carriers and they might bring the disease home, and the adults, especially the grandparents, may be affected. But having said that, this was the first wave, where we actually thought most of our children are asymptomatic, and we were in the first wave, we were not seeing so many children because probably they stayed asymptomatic because as far as the studies now go, they say it's the denominator that is huge now. Like the number of cases is much more. So if April to May last year was 1,000 cases, April to May this year was a lakh. So it is like 100 times more. So if the percentage of children was 9% then, it is 9% now too. But it was 9 in 100, but like now we are seeing, I'm seeing it would be 900. So automatically it appears that a lot of children are coming down with COVID. And why is this so? Is that this time it is not completely asymptomatic. We have a lot of children with mild symptoms. So it is not that they are just getting detected as part of a screening of the family, and but some big, I would say 60% of children who are with me with COVID have not got accidentally detected by screening. They've come because they've had symptoms. So, but unlike adults, in children, most of it is mild symptoms and a lot of it is still asymptomatic.
So, what are the symptoms we can manifest in kids, ma'am? Whether there is any categorization like mild, moderate,
Yes,
severe?
yes, yes, absolutely. There is categorization, and so our treatment also goes accordingly. And the good news for all your parents out there is that 90% of children, they have mild symptoms. And what are these symptoms? There is fever, there is runny nose, there is sore throat, there is cough, there may be shortness of breath. Now, this second wave, we are seeing a lot of children with gastrointestinal symptoms. So they
mm,
are having vomiting and loose motion. I'm seeing a lot of children with rashes. Then there are children with headache and fatigue, a loss of appetite, loss of smell. Loss of smell, which is kind of so dramatic in adults. Now,
mm,
somehow children really don't complain of that so much, but
mm,
most of the children that I'm seeing is with fever, respiratory symptoms, and your, vomiting, loose motion, which was not
mm,
happening
mm.
in the first wave so much.
Yes.
And this time we saw a lot of children. So this is for parents that do be guarded that if your child in these times is having a loose motion, and do think of COVID, because your doctor will surely say COVID. And so if the doctor suggests a test, do not get alarmed that how is he saying, get tested for COVID when has
Mm,
no respiratory symptoms. So that is mild. Now
mm,
the moderate would be again fever. In
mm,
moderate, what we see is fever. There may be breathlessness. The cough may be more intense, and
mm,
we also tell them to monitor here their activity and alertness. And in the moderate, this is the group which can have pneumonias. So
correct.
this is something that I'd like to share with all the viewers there, is that when you have pneumonia, it is you see fever, cough, and the breathlessness. You have to count the breath. And there is a laid down age criteria globally for it. It is the same for children worldwide. So I would say the children less than 2 months of age, if it is more than 60, 2 months to 1 year if it is more than 50,
Mm,
1 to 5 years if it is more than 40, and more than 5 years if it is more than 30. So when we have a family with a child who's got COVID and they've got mild symptoms, we are okay. We don't alarm them about these, to calm breathing. But if I have a child, who's got cough, who's looking a little more sick, then
mm.
we would tell them that please keep a track on the
The respiratory.
respiratory rate, it's called.
Mm, mm,
Now, so when we monitor, we tell them that keep a track on temperature, keep a track on respiratory rate,
mm,
level of activity and alertness, and is the child playful eating. A playful child, when I'm doing video consults, and when I always want to see the child, and so when I see a child playful, active, and moving around, I know all is good. Now you said criteria. Now,
mm,
so I would say 90% are mild, and about 5% are moderate, 5 to 7% are
mm,
moderate, and
mm,
maybe just 1 to 2% is severe. And those are, severe pneumonia with cyanosis that is turning blue,
mhm,
then ARDS, that is in acute respiratory distress, multi organ failure, septic shock with, tanking of the blood pressure. Now,
mm,
those children definitely need hospitalization because they need very close monitoring and they need life support, like
mm, mm,
intravenous injection and oxygen. In moderate group, also of the moderate group, 80% can be managed at home. So
mm,
that is the good news for parents there, that 97% of children can be managed at home, but you need to know how to monitor it with the guidance of your doctor and what I share with you today. I'm
mm,
sure you'll be able to cope well. And do not panic. That is where we go wrong.
mm,
Parents are shattered when they hear their child has
mm.
COVID.
Ma'am, you have given a very reassuring messages like 90% are mild and don't panic.
Yes,
These two words
yes,
will be having a very positive impact to a lot of people viewing here. Thank you, ma'am.
yes,
I want the basic tests which you do for the adults, like RT-PCR antigen test. This test holds same thing for the kids
yes,
also, right?
absolutely,
Yeah.
absolutely. it's the same test, and like the RT-PCR is the gold standard, so one would do the RT-PCR. But you
mm,
must remember something, that if your rapid antigen test is positive, then
mm,
you don't need to repeat a
mm.
RT-PCR.
Correct. Mm,
Sometimes people say that, but
mm,
still, let me do that. Maybe in that it may be negative. No, that doesn't hold true. If the
mm,
rapid antigen is negative, because it's a poorly sensitive test, you
mm,
might have a positive RT-PCR, but
mm,
not the reverse. Like if the rapid antigen is positive, you won't have an RT-PCR
mm,
that
mm.
is negative. So yes, the test remains the same.
I think present scenario, ma'am, I think any symptoms should be considered as a COVID unless proven otherwise.
Absolutely. You are so right, Swapnil.
Yeah.
So, in the clinic, if I am, I would say out of the 10 children that I am, say consulting in a 2 hour slot, say these days, we have,
Mm,
less patients coming to the clinic, of which 80% maybe I'm doing a video consult. Of these 10, 8 are COVID, and out of the two, one may be doing an asthma follow up, and the
mm,
other may come for immunization. And one thing I really like what you brought out in your introductory comment, and compliments to you that you brought that point very well, that because of this COVID, they are losing out on their routine immunization. So when the
mm,
first wave came,
mm.
even the
Most.
pediatricians, even the health worker, even the government didn't know what to do. So,
Mm,
a lot of immunization got stalled. In the
mm,
government sector, it still got stalled because
mm,
everybody was deployed to
mm,
fight the virus. And
mm,
then they realized that in this, if we have an epidemic of
mm,
measles, we've had it.
mm,
Uh,
mm,
so, again, the message to all your viewers there and parents, please, 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 please do go to your pediatrician to complete the immunization as scheduled. Of course, if
mm.
your child is ill, your doctor will tell you when to go. But if all is well at home and the family, fix up an appointment and choose. And all the clinics are giving all these well babies different
Mm,
slots. So
mm,
we have slots like that. Like for me, there is a slot for immunization. There's a slot for asthmatic, and then there's a slot, and there is a major slot for any child who comes ill.
mm,
So
mm.
we are, and do not worry about going to health setups,
Mm,
because we are taking care. But if
mm,
your child is ill, please inform and
mm.
check if your doctor would like to do a video consultation, and if that works out for
Yeah.
both of you, because you are spreading the buck then.
Yeah, I will request all my friends that we'll be addressing all your questions at the end. So if you have any questions, just put in the comment box. We'll be addressing at the end. Ma'am, just wanted to know, since COVID has struck badly, and is there now we have different age groups in the kids, it could be teens, toddlers, infants, and middle whatever child. So any particular age which is more susceptible, or all age groups are equally susceptible?
See, it's a rogue virus.
Mm,
Last in the first wave, we said it's more than 60 and people with comorbid.
mm,
And this time, you've seen there are so many people, so many young people I know who are in their 30s and whom we've lost.
mm,
But since you restricting the talk to pediatrics, I
mm,
would say the ones who are more vulnerable amongst the children would be the kids who have, say, who are obese, who have diabetes, who have chronic lung diseases like say, cystic fibrosis, they have a
mm,
congenital heart disease, they
mm,
have endocrinal or genetic disorder.
mm.
So these are immunocompromised children who are on cancer medicines. So they are more at risk. And also, newborns are very vulnerable, isn't it, for
Yeah.
any diseases. So it's sad that a lot of girls got pregnant during the first wave, and so they are delivering now. So we are seeing a lot of newborns also with COVID, and it is worrisome because these, when we are following them up, in after 2 months or so, they are coming with post-COVID sequelae.
mm.
So that is a very vulnerable age group.
So basically, I will say that each child is susceptible to this infection,
Yes.
and secondly, you have given the predisposing factor, like it could be
Comorbid.
asthmatic, comorbid condition. They are definitely at the high risk for those
Yes.
infections, and they'll be in the categorized in the definitely in the serious. They might go into the serious infection in the rapid rate, I suppose.
Yes, we need to monitor them more closely. But
Mm,
having said that, it's very difficult to predict that who is going to land up in the problem. Like,
mm,
so
mm,
you see, in pediatrics,
mm,
there is another issue called the multi-systemic inflammatory syndrome of children, which is
mm,
MIS and a little gap C. That's multi-systemic inflammatory syndrome children.
mm,
Now, even children who've got mild COVID, or even children who've had been asymptomatic but COVID, have landed with this very, very, very serious entity. And
mm,
I personally know two children. One very dear friend's grandchild, and one who was with us at the clinic, and they were, the first one was absolutely asymptomatic, was part of screening. Somebody visited that home who had COVID, informed the family, and they all tested positive. And and then 2 weeks after that, the child started having high grade fever and rash, but was with but the important thing is just stay put with your doctor. Like, I tell my parents that I'm going to handhold you, don't panic, inform anything that is untoward. These are the situations, this is what you need to look out for.
mm,
And those children, they have to be hospitalized, they have to be given immunoglobulin, they have to be
mm,
given intravenous steroids. So you cannot predict which one will go into that. So it is a preparedness and knowledge that this is what we need to be aware of, and this is what is
mm,
MISC. I think without making my parents afraid, like after 2 weeks, when I say, okay, it's been good, fine, now, if you need me, then I say, if your child comes down with fever again, which is persisting for 3 days, and the child is beginning to be listless, not active, or the child is having rashes, is having, non purulent conjunctivitis, the angle of the mouth or the tongue is red and swollen, or the child, you feel that the child's heart rate is fast. Nowadays, everybody monitors, right? So that is how my patient picked up. They said that saturation is okay, but the pulse rate is very much. So that's the heart rate. Because
mm.
I told them. So you need to, and they need to be hospitalized pronto.
Well, I mean, we have seen now most of the second wave. People turned up on the 10th day, 11th day. They turned up because they at home they ignore a lot of the symptoms. They did their own medications. They didn't inform your doctors. And when they
Yes,
come at the later stage, is already a COVID pneumonia, which is out of control, and it's
true.
already in the hypoxic state. So that becomes out of control. I think
You're right.
similarly in pediatric also will be the same, like ma'am. If you detect all
Not
these symptoms,
really, not really, Swapnil.
okay.
Parents love their children. This
Mm,
issue that you've said,
mm,
that is why we are losing so many young adults in the second wave.
mm,
Because you see, the second wave kind of hit us, right? We were
mm,
not even expecting it. And
mm.
the young people still kind of kept thinking that, it's going to be the elderly. Oh, I'm so
Yeah,
fit.
correct.
Nothing can
Yes.
really happen to me. And,
Mm,
and they were back going to the gyms, and they never thought that they could be affected. So when they had fever, they thought, it's just a viral bug. When they saw that, they didn't even have pulse oximeter. Why bother, right? It's a disease of the older people and people with comorbidities, not fit young people. And then when they got breathless, they thought, it's okay, I'm going to come up. I'm going to come up.
mm,
And so they would reach hospitals when their saturations were not 94, 90, 90, which is like people say race. They would go when it is come below 90, 75, and there's so much of crisis for bed. That's what's happened.
mm,
And some out of panic have already occupied those beds. Some who've got, like there's a crude word called patti, have already taken the beds if they're COVID positive, that in case I deteriorate, the oxygen is right there. The nurse is monitoring, the doctor is seeing me morning, evening, night, and the ones who really need it. So, coming back to what you asked me, that will this situation happen in children? No, that is because parents love their children much more than they love
mm,
themselves, much more than even they love their own parents.
mhm,
So they will send the kid away if they've got COVID to the grandparents. And I say, why did you do that? Your parents are more at risk of getting a
mm,
moderate to severe form of the disease than your child. So, no, what you said won't happen. With children, they are not sitting the first thing of fever, and we are telling them, let's monitor at home, come to us later. No, they want to sit across you when they meet you. And when you tell them, they are in denial, they are crying when the RT-PCR is
mm,
positive.
mm,
But I just had a couple, both parents in the police force, and in the first wave they both got COVID. Now this child, my nurse told them, when was having fever and body ache, they said, she told them, you don't need to come, just get the RT-PCR done, inform us and we will get. So they said, no, cannot be COVID because we are not going anywhere, and we've got COVID. That is where we go wrong. We may
mm,
have had COVID, we may have got the vaccine, but you can still be a carrier. So
mm,
till all the children, till everybody is immunized, nobody is sick.
mm,
So then when I said, no, we need to do the test, they were in a bit of a denial. And next day, like, their world shattered. They said, he's artificial positive. She's crying. This tough looking cough. And but parents are concerned. They just,
mm.
for them, it's their kid is their world.
Yeah, that's also you have said that 90% will be mild symptoms. So
Absolutely.
yeah, so
Absolutely.
there's a
So
very I think we are quite safe. I would say kids. I will not say that we have to be cautious in regards
absolutely.
to kid, not be reluctant. Say just like that, ignore symptoms. Anyway, no parents will ignore it, and they will
Yeah. And
immediately
that's
report it.
not,
Yeah,
true. We should tell them. I
monitoring is
tell
important. Yeah.
mine, yeah, monitoring is important. The temperature,
Mm,
the pulse ox, the alertness, the
mm,
activity, the respiratory rate. I tell them 5 things. I write it for them, and I said,
okay.
monitor these for me. Write it on a paper,
Mm,
because don't tell me at 9 he had this much fever, at 12 he had. Write it, send me the picture of the
mm,
saturation, tell me a picture of your temperature record,
mm.
and of course the alertness activity. I see them when I'm doing the consultation,
Yeah,
but
yeah. When you
it's
have a record, you can compare it. I also.
yes, absolutely.
Yeah.
They can also alert you.
Mm,
They can also alert you, and sometimes, and when they are doing, I tell them, fix the pulse ox and show me yourself. Because if it is loose, obviously it's going to show low values and they're going to panic.
mhm. There is a expert virologists have said about the third wave, and it might affect the kids. They are predicting the third wave affecting the kids. Now, if you look at the situation at present, second wave, it's what I started in the starting is the middle age group, the young population is getting affected because the virus has turned mutant now and it has become more infectious. So definitely the virus will again mutate because again probably because all are getting vaccinated, probably all are getting infectious. So the next host will be the kids. So probably, what is your opinion in this regard, ma'am? The third wave, are we expecting, or will it be a severe? What is your take in this regard, ma'am?
So you see, Swapnil, if you see the COVID-19 pandemic, it actually finds a reflection in the Spanish flu
Mm,
pandemic.
mm,
And in Spanish flu, also they saw, that the second wave was the strongest wave, and that the number of cases were much more, like it
mm,
was like that. And the second and the first and the third wave put together was equivalent to the second wave. So
mm,
if we say that most of this COVID-19 pandemic is behaving like the Spanish flu, then I would say yes, there is going to be a third wave. I'm quite sure about this, that there is going to be a third wave. But that, will it affect our children more? That's hypothetical. But and why are they saying is exactly what you say, is that, see, look, the virus has to survive. We all, it's
mm,
survival for the fittest. Now the
mm,
virus is going to mutate because we are vaccinating to protect ourselves.
mm,
So the present variants are also mutants. Some are double mutants. So they are more vicious in their infectivity. That means they're infecting more. Is it more severe? Still people don't know, because the percentage of death, the percentage of admission is the same. It's just that the denominator is so much more. So
mm,
meaning it's infecting more people. Now the grim reality is that a lot of us are getting vaccinated, and I we should be getting vaccinated much more.
mm,
But you see, in India, about 35% of the population is less than 15,
mm,
which is a huge percentage.
mm,
And so the virus is going to say, yippee do. And would the 65% be vaccinated? No. I mean, if the rate that we are vaccinating, it will take 2 years. But the government says by December,
2 years.
hopefully, most of the country would be vaccinated. And I would want to believe it for the
Mm,
sake of the people of the country. But
mm,
the thing is that, would the children get start vaccinated by then? We don't know. But so yes, the virus might go towards kids, but would the kids get more severe form of disease? Perhaps not, because in the second wave, which is also such a vicious wave, and it's a mutant virus, it's a double mutant variant, it is still not so vicious. It's just that the young people are waking up late, and the number of cases is much more, and the kids actually have a different kind of an immune response. So
mm,
because they are, or unlike adults, they are exposed to a lot of viruses, so they're constantly coming down with cold cough. So coronavirus, not COVID-19, coronavirus was there too, giving them cold and cough. So their immune response to it may be different, and hopefully that even if more kids come down, I'm just hoping, keeping my fingers crossed, that they continue to be mild. So I would also think that it's a hypothesis, but it has some ring of truth in it. So
mm,
there is going to be a third wave, but I think it will be low. But a lot of states like Maharashtra
mm.
already has a task force in
Yeah,
place
the
to
preparation.
combat the crisis. There's a
Even
pediatric task
UP has
force.
started one. UP has also
Yeah,
started.
yeah. UP, Karnataka is trying to put its thing
Mm,
into place. So
mm,
people are, aware, and we are telling people exactly this, that your kids. So what should you do then? You should ensure that you are vaccinated. You
mm,
should ensure that if you have a live-in house help, please register her, take her, get her vaccinated. If
mm,
there are people who are visiting, you have a part-time help her get vaccinated, so that even if anybody, your children are at home, but
mm,
if they are coming into contact, they should be vaccinated. And please, 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 it's, in India, the situation is such that we tell people, don't get your children out, to into the common play area, even with mask and all, because you never, it's an airborne disease now, we know.
mm,
So you never know. So a lot of one of my mothers said that, doc, the whole family, all of us and our child, we are all COVID positive, and we've come out of it. We've done our home quarantine. Can we now go down for our walks and into the play area? And I told her, isn't that being unkind? Just because you have got the disease and your family is safe, at least safe for the next 6 months. But when you are walking down with your child, there may be a family and the child might be looking down, and already the kids are so bored and they're troubling their parents, they're throwing tantrum. The parents are, now smoking from their ears because it's over a year. So I said, how terrible for that child to say that, look, my friend is down with the mother, and why can't I go? It's very difficult for the mother to say they've already suffered, so they've gone. So I think we need to be very, very inclusive, and we need to, I think the pandemic has made us wiser, kinder, more inclusive in every possible way.
Ma'am, we can consider, since a family has come now. Now, if you consider different situations, like a family, suppose you consider a family and a son or a child, a mother and child, what could be the situation? We have a different situation now. I'll be noting down. First is mother and child positive. Mother is positive, parents are positive, child is negative, child is positive, parents are negative. So how to manage in such situations like that? A different
Let's
scenario.
do them one by one. Let's
Yeah,
do them one by. So you first said that mother and child both are positive.
positive. How should we manage at home in
So
such
mother
scenario?
and child both are positive. The father is
Yeah, possibly.
negative. That's what you
Yeah,
said.
the parents
Okay.
both can be positive, and both positive, and the
So
child also
meaning,
positive.
so this is a whole family that's
Yeah,
positive.
yeah, yeah,
So
yeah,
that
yeah.
that is what is happening to most units now.
Mm,
Because like you correctly said that the second wave, this mutant virus
mm,
transmits very fast.
mm,
It's very vicious in its
mm,
infectiousness. So
mm,
the whole family is COVID positive in this grim situation is a win-win situation, that
mm,
they've all come down positive.
mm,
So of course, if they've got a part-time help,
mm,
definitely she shouldn't come, and definitely after 5 days they should ensure that she gets tested, because it is our responsibility to help people who work for us. Their health, their family's health is also our responsibility. So the
mm,
person who's come to you,
mm,
you have to. So those anyway, there is no problem. A whole family COVID positive, home isolation,
mm,
stay in touch with your respective doctors, monitor at home, and that's the best situation to be in.
mm. So
What's the second situation? Yeah.
now monitoring, when it comes to monitoring, the five things which are important: pulse,
Temperature,
temperature.
pulse ox, activity,
Mm,
alertness,
mm.
respiratory.
Yeah, five things. I would request all the viewers, these five things which ma'am has told, that all, if all are positive, these five things need to be monitored in the child also. So
Yeah.
now, ma'am, the parents are positive, child is negative.
Okay. Now, it's again, if both parents are positive and the child is negative,
Mm,
you should still keep the child at home,
mm.
because your child may be an asymptomatic carrier.
Very.
Maybe you've investigated early, which is happening in a lot of situations, that
Mm,
the parents have come down positive, and right away they've investigating the child, but the
mm,
child may be still in the incubation period, right?
mm.
So, and it's come negative. So what they've done, they've sent the child away to grandparents, or
Grandparents,
they've sent the child away to another family,
family.
to one of the parents' siblings may be living in the same city. And they
Mm,
said, we are both positive, keep our child with you. And no, that's not a right thing to do, because your child may be a carrier,
mm,
and still not positive, and you are infecting another household. And it is also, we have to, it has a huge impact on the psychology of the parents and the child, that the child as such is world is turned upside down thanks to COVID. There is no school, there is no play, there are no friends coming home, all
mm,
activities, and then my parents are also sending me away. So, like, even in parents, if they're monitoring, maybe, of course, most certainly they should be masked up, and also keep the child masked. If the child is more than 2 years,
yes,
definitely should be masked up. If the child is less than 2 years, not
mm,
masked. But then, how do you keep a 2-year-old away from the mother? One of my uh, family, now, you know what I'm sharing with you, a real life situation.
mm,
So, mother had moderate COVID, father had mild COVID, and
mm,
the child had mild COVID. So the father and the child were together in one room, and the father would do video consults with me.
mm,
And then one day he said that, my wife is having severe gastritis and is vomiting, and her doctor is alarmed. So I said, see, your child is positive and is mild. You're all positive. Why can't the mother be with the child? What
mm,
more? What more can happen to a child? A mild child with a mother who is moderate cannot become mild to severe. He's
mm,
already, so let the family be together. And
mm,
after, when I did the follow up after 2 3 days, the mother that time came on and she was smiling. She says, I was I was so distraught. So they really don't need to be separated from
mm.
their
Mother.
children. Yeah.
Yeah, I will say that the wrong practice is the child still can be a carrier, and we need not
Yes.
send the child to other families' house or grandparents. That is not
Absolutely.
that is wrong practice.
Definitely not grandparents,
Yeah.
and not even other family. I've had a family like that. They
Mm,
sent it to a sibling, and this child, they put him into another room, and
mm,
from there, we would do group video calls. The parents COVID positive, and the child in another thing,
mm,
and he
mm,
looked so upset, that
mm,
the
mm,
family has, and then he turned RT-PCR positive. I said, he's negative because you've done it too early. So
mm,
this is something that I want to share with
mm,
parents, is
mm,
that when should you test your child if you are positive? Is
yeah.
that if the child has no symptoms, okay, then ideally after 5 days.
Mm,
If the child has symptoms, so you're RT-PCR positive, and your child is also got fever and a little bit of cold, and you're saying that I he must be positive, let me not do the test. No, you should do the test.
mm,
I'll tell you, the reason for doing the test is that, yes, they're all mild, most of them are mild, but there is that small percentage which is moderate. And we also, there may, this child might, who knows, go into MISA. We don't want it to happen. But if suppose there is a deterioration and you need to take the child to the hospital, now the hospital doesn't know, does this child go into the COVID wing, or does this child stay in the non-COVID? And
mm,
then you're making the child, then you're doing the rapid antigen and it's negative, but you're saying that both parents positive. This is
mm,
probably, but and the healthcare is kind of exposed to a child who comes with a non-COVID kind of a certification. But so it is important. I think it's imperative that if the family has is COVID positive, that they should get their children screened, but not right away. Definitely after 5 days.
5 days. Okay, ma'am. One more thing, and now the last scenario is parents are negative and the child is positive. I think we have just missed the connection with the madam. So I would say the viewers that what madam has told at present is if your child is still negative, you have to do your COVID testing. That's very important because the child can be a carrier. So you have to do your COVID testing RT-PCR, which is very, very important, because don't say that you don't assume that he is positive and avoid the testing. So RT-PCR testing should be done. And but in case of a, what I will say that in case the child doesn't have any symptoms, then RT-PCR should be done after 5 days of symptoms. This which madam has just now pointed out. And even if you have a family and if your child is not showing any symptoms and he is asymptomatic, he can still be a carrier. So don't think that he cannot spread infection. So don't send your child to your parents' house. You don't send you to a relative's house, or don't send to the other houses where you think that a child will be safe. No, it is not like that. He'll be still be spreading infection. So keep your child with you always, and you need not do separation based on the criteria in the house. If all are positive, you can all stay together. There's nothing like that. You have to separate your child altogether. If it is mild positive, it is okay to you stay together. You don't have to one parent staying in one room, one parent staying in other room. You need not do that. So that is not required. So in this scenario, I would say it's very, very important that you require to be cautious of what is to be followed in this scenario. Secondly, madam has told that we need to do the monitoring as of now, like 5 parameters: fever, respiratory rate, heart rate, all these things to be monitored. And the monitoring is very important because this will help you in charting out what level it will be. So in this regards, it will be very useful to know the prognosis. And if the prognosis is good, then definitely he'll be able to help you in recovering the child faster. So this wanted to know. And regarding the vaccination part, you have to vaccinate your child. You need not stop your vaccination. Vaccination is very, very important. You can keep a time gap. You can discuss with your doctor. If you are COVID positive, if your child is COVID positive, still you can get your child vaccinated. And vaccination part is very important. You should not ignore your vaccination, because the whether it's flu vaccine or any other vaccine, the vaccination part is important, because if you ignore the vaccination part, the child might succumb to different infection. So that shouldn't happen. So vaccinate your child irrespective of your COVID status. If you have COVID, just inform your doctor. Maybe after time gap, you can say that the child can be vaccinated. That's important, but don't ignore your vaccination. Vaccination is very, very important in this regards. So that is one thing. And regarding the third wave, madam has already said that third wave, we can assume that it might come, but probably the only thing is we will say,
Hi, Swapnil, I'm sorry.
no
This is
problem. I was informing the crowd about the same thing regarding the third wave. So I would say that whoever viewers have joined just now, I want to say the third wave is expected, but we don't know how severe it will be for the kids. So we need not panic at this moment, but we
yes,
need to be
absolutely.
aware, and we need to be cautious, and we will be taking all the precaution, and that is what is required. So awareness is important, and taking care of our kids is important. Ma'am, the next question. Thank you for joining again, ma'am.
Yeah,
I think,
there's
yeah,
cyclone here, so
yeah,
it's on a backup. I hope it doesn't
okay,
go again when
yeah,
it's
okay,
coming back.
okay, ma'am, okay, ma'am. Ma'am, the next question is now, when you monitor the monitoring of the saturation for adults and kids are the same, or there is a parameters are same, or it's something
No,
different as
the
well?
parameters are the same. It's less than 95 in children that we say is
Mm, mm,
uh, that we need to be aware of,
mm,
and we need to apply it well. Now, in children, most of the time it could be the middle finger or the thumb, and
mm,
in a very small baby, it could even be the great toe. It
mm,
just has to fix well. But it is 95 is the cutoff in pediatrics.
95 is the cutoff. Now,
Yes.
ma'am, now child will be jittery. Child will be not allowing to connect the pulse oximeter. In that situation, what you will suggest? Like, what is the practical tips you will give in this situation?
See, the most important monitoring is you cannot have in children particularly there would be some breathlessness before the hypoxia,
Mm,
and unlike an adult COVID where you can have happy hypoxia.
Yeah.
So the child would be irritable. So a hypoxic child would get irritable.
Mm,
So would not be playful. Would be breathing fast. So
mm,
normally they are pretty excited. So I have seen from sleeping child you can do, and a grown up child if you explain, because if you put it, kids like to imitate parents. So if you put it on yours and you put it on them, because it doesn't hurt at all. So they
mm,
are quite okay, and they're seeing the lights coming up and the monitors. I've actually not had any children
mm, mm,
fighting
mm,
about the pulse oximeter. And also temperature record also has to be kept. Here, Swapnil, I'd like to mention something is that those infrared thermometers really came into vogue thanks to COVID. Now, those are okay for screening, entering housing society or going to a mall or office. They're
mm,
not good for home monitoring or for hospitals, for
mm,
which you need a thermometer. So that, and also something that all of us should know, that if you are taking, now we say less than 5 years, you should do a rectal temperature. Now, most parents are uncomfortable doing that. They are. So you don't have, except for in the neonate age or less than 6 months, when we say rectal temperature is where you get more accurate temperature. You should actually, so most parents do axillary temperature, but if you just say it is the skin thing, so it should not be with clothes. Take off the clothes and do it, and keep till it beeps, or and that, this is not the core temperature. The core temperature is zero point 0.6 more than what you're, so zero point 0.6 to 1 or zero point 0.5 to 1. Different studies show different thing. So on a random, I tell my parents that if it is 99 axilla, actually the body temperature is 100. But don't panic because of the temperature. And another thing here I want to say is that the only drug that you need to use for fever is paracetamol, and
mm,
nothing but paracetamol. Do
mm,
not race into those multiple combination, paracetamol plus this, paracetamol plus X, paracetamol plus Y. You don't need to do that. Just
mm,
plain paracetamol in the dose that your doctor has advised is what you need to give to the children. In
mm,
adults, they say paracetamol 4 times a day. In children, we don't do that. We say
mm,
give paracetamol when there is fever. So what I tell my parents is that monitor the temperature the first few days every 4 hourly. Take the
mm,
pulse ox every 6 hourly, and
mm,
after 3-4 days, if everything is maintained, then I say temperature 6 hourly, pulse ox 12 hourly, stroke SOS. You can't say 6 hourly and forget about it. If
mm,
between the 6 hours the child is having fever, you
mm,
need to take it. And
mm,
after everything has settled and 2 weeks are over, because you see, the first phase is the viremia. So that fever is because of the virus,
mm,
it's replicating. So
mm.
the body, why is there fever? It's the body that says that,
Fighting
but
capacity.
you need to fight, you need to
Yeah.
fight. So that is why the fever happens. And the next spell is of the inflammation. Now, the
Inflammation.
inflammation is not so much in children, but for the MISC. So if you see in this wave, in the second wave, a lot of issue is not just the hypoxemia in young adults. A lot of issue is that my pulse saturation is maintained, but it is day 7, day 8 of fever, and they go, and they are already in the inflammatory stage. And
Mm,
so it's then that the pneumonia is setting in and the inflammation is setting in. It's not, it's
mm.
it's not the viremia.
It's
and
an
and also the misuse of drugs. You see, a lot of adults that you told me, they feel we are young, we are smart, we
mm,
can Google, and the WhatsApp is giving so much of advice. So
mm,
they self-medicate with steroids, and steroids given in the first 5-6 days of the disease can be lethal. In mild symptoms, it can just make your viruses replicate. It's
mm,
happened to a family member, young 42-year-old adult. Of course, he had a comorbid of obesity and hypertension, but very smart, intelligent, successful young man, but landed into deep trouble because went to the doctor on day 2 of fever with cold cough and was given steroid. On day 5, started feeling restless, and he saw that his saturation is 88. Just picked up the wallet, called up a friend, and ran into the ICU. Was in the ICU for about 14 days and is now, on 1 liter oxygen. So it can be so dramatic. So an
mm,
appeal to all you young people there. A lot of people who are listening in are young. You're listening in for your children. But
mm,
remember, don't harm yourself, don't self medicate,
mm,
don't feel so. Again, a young adult that I know, called me up for some advice, and then I said, what is your doctor advised you? So he says, I didn't take any doctor's help. I'm using what he told my friend.
mm,
So they are sharing
mm.
screenshots of
Sharing.
each other's
Mm, mm,
prescriptions.
mm,
So please don't do that. So azithromycin, ivermectin, doxycycline, and
mm.
please, 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 for all your parents out there, none of these drugs have any role in pediatrics at all. Now it doesn't even have any role in adults, but a lot of adult doctors, they are, we need to upgrade. Like, say, we are all upgrading, and every week there are
Mm.
various, talks
Okay.
happening,
So, mm,
virologists. So we have to upgrade ourselves. So there was a time when there was hydroxychloroquine last year. Remember, first year?
yeah, I
Now
remember.
it
Yeah.
has got, now it
No.
has got two things. Then ivermectin. There are
Mm,
some governments in India which have said ivermectin to be given to all adults as a prophylaxis. No,
mm,
ivermectin has no role.
mm,
Azithromycin has no role. So
mm,
parents of all those children there, you can question your own doctors when they are prescribing all this, because none of this has any role.
mm,
And but yes, okay. One thing more that I tell the parents is that there should be rest, and they should drink plenty of fluids.
mm,
Because there is an infection, there is a fever. They may have a little loose motion. There
mm.
is fatigue. This
Dehydration.
this in second wave, I'm seeing a lot of children complaining of headache and fatigue.
Mm,
That there's tiredness. So
mm,
see that they drink enough fluids. So
mm. So, ma'am, this medications, azithromycin, doesn't work in kids. Nothing, no of the
not
medication.
at all,
Plain
nothing.
paracetamol for fever should be ideally suffice.
So well, if I have the permission to say so, is
Yeah,
that it doesn't even work in adults. So even in
yeah, yeah, I
adults,
know, I know.
and why sometimes parents say that no other medicine, doctor, because they anyway know the paracetamol, because
Mm,
I've taught them about paracetamol, I've taught them the
mm,
dosing, I've taught them, because their prescription has azithromycin,
mm.
ivermectin, and
Doxycycline.
they doxycycline, and they also have done so many tests. So
Mm,
they've had the D dimer, the ferritin, the
mm,
renal function test, the
mm,
liver function test. So they
mm,
say, we can do other tests also, and I have to tell them that you really don't need any more tests. But
mm,
yes, if a child of mine is having fever, 3 days, and the fever is there, I would do a hemogram and CRP. So most of the time they are presenting on day 3, day 4 of fever. So we might do a hemogram and CRP, and most of the time, it just shows low count and raised lymphocytes. It just, sometimes they get alarmed when they see that the CRP is a little high. So
mm,
they send me a thing that, ma'am, it's more than the. No, it is just for me to know that I need to track this if
mm,
this fever persists, because,
mm,
like I said, MISC, in these markers might start rising, and in adults they do liver function tests, renal function tests, because that in case we need to give drugs which are hepatotoxic and nephrotoxic to do the test. But no, I don't think we need to subject our children to more trauma.
Hey, one question I just want to ask, ma'am, regarding the
Sure.
monitoring of the saturation, oxygen saturation, how frequently you should do the monitoring of saturation in case?
So initially I tell them 6 hours.
6 hourly.
and then I tell them 12 hours. You do it once in the morning and once in the evening.
Okay.
And at any point of time, if you feel that the child is, but they actually, I see whenever they are doing the temperature, they do the pulse ox also. Like they do both the things. They put the thermometer and they fix
Mm,
the pulse ox, and it's a go because all the monitoring sheets. So you have to show them a sample sheet and tell them, and they feel very good. They feel they're included. And I
mm,
tell them this, that when you are admitted, this is exactly what the nurse is going to do. And this is exactly what your doctor is going to come and see the chart. And this is
mm.
what you can do at home. So do
Yeah,
not
ma'am.
panic. We do not need no hospitalization, nothing.
Okay, ma'am. Regarding the temperature part, ma'am, the mercury thermometer or the other digital thermometer, what you will prefer in this regards, ma'am?
Swapnil, I'll confess, I'm a big believer in the mercury thermometer.
Mm,
But nowadays, there is so much of this thing hype about the toxicity of the mercury thermometer.
mm, mm,
So, in fact, a mercury thermometer rarely is fallacious. A
mm,
digital thermometer, one which the cells are old, can
mm.
give whole lot of wrong reading. They'd say
Wrong reading.
temperature is 86 degree, and how can that be 86 degree?
Mm,
So, we actually in our clinic, when we teach all our parents how to monitor and nowadays you get nice fat mercury thermometers which don't break. So why do
mm,
they say it is toxic? That in case it breaks and in case the mercury comes
mm,
on,
mm,
they are thing. But I would say a good quality digital thermometer is also good. The
mm,
tympanic membrane thermometer is also fine. But again, if a child has wax in the ears, if a child is crying, you may not have accurate readings. So, a thermometer, whether a mercury or a digital most parents prefer to do, but they just have to ensure that they place it correctly.
mm,
And in small children, if they can do the rectal temperature, nothing like it, because that is the core temperature. So those we need to tell them that this is how. And I
mm,
always ask that, do you know how to take temperature? And if you don't know, there is no thing in saying that I don't know. It's okay. It's my
mm,
job to teach you, or my if they are
mm,
in the clinic, then the nurse teaches them. And
mm,
so, we actually tell them that they can keep it under the tongue, but during COVID times, we are not encouraging that even at home, because you can't have a thermometer for four people staying in the family.
mm,
So they won't have one each. So they
mm.
are sharing.
Okay, ma'am. And what about the blood test? Any blood test to be done, ma'am, in the kids especially, or it's RT-PCR is enough for anything like that?
RT-PCR is enough, but if the fever is not, is say day 3, day 4, day 5, and the
Mm,
fever is not settling. So what happens in viremia? What happens in all viral infection? It goes up 1, 2, 3, 4
mm,
days. The fever is high, and then it starts settling.
mm,
Ideally, it should settle. Now, if it is not settling, that's the time that I would do a hemogram and a CRP.
mm.
But otherwise, I would do no test. And
Oh,
again, an appeal to all of you, those Swapnil, you're a radiologist, there is a misuse of the CT scan, right?
yeah, I don't
So they
recommend
wait.
kids.
I'm sure you don't. I'm sure your professional heart and
Mm,
uh, your the community heart is in
mm.
the right place. So
No,
I'm.
I
I,
would say as a radiologist, I would say directly that don't do CT scan in the kids unless it
yes.
is very hospitalized, severe thing. That is a
Yeah,
different
and
issue.
then the pediatrician will, like the pediatrician
Yeah,
advices,
yeah,
and
yeah.
pediatricians are very, very, I would say, conservative
Mm.
about, because it's exposing a child to so much
Mm.
of radiation. Yes,
Radiation.
I'm
Yeah.
lifelong, and you see a lot of adults now. I know a lot of young adults.
Mm,
A whole family is COVID positive. Now the mother tells me this. I got to know the story when the child came down positive, and because it's an
mm,
asthmatic child, they panicked a little bit more.
mm,
And so she said that my husband's admitted for with COVID. So she said that he was a little breathless, and his saturation was thick, And RT-PCR was taking so long to get a slot and to get the report that we knew the radiologist and we went and did the CT scan. And you know, and the score was also pretty
Low.
low. Like it
Mm,
doesn't really show. But that young adult has just got exposed to. Now my
mm,
neighbors, they both of them had they were COVID positive, the whole
mm,
family.
mm,
And again, there was no problem with
mm,
funds.
mm,
And they just texted me that, ma'am, we've got our CT scan done, and good news, it's normal. So I
mm,
said, who told you to get the CT scan done? Your physician? They said, no, our friend said it is best to be
mm,
sure and safe. Now, this is what is happening. You
mm,
know,
mm,
friends and the WhatsApp university is spreading so much of things. Your doctors are there to help you. You know, they are there to guide you. Yes, sometimes they may be hard pressed, and you know, but like, don't think any question of yours which you think is stupid, they will say it's
mm,
stupid, shut up. No, in these times, I think all of us, you know,
mm.
are you know, much kinder and much, because we know what all of us are going through. You, us,
Yeah,
all of us. So
yeah,
just
yeah, ma'am. Yeah,
ask
CT
the right
scan.
person
Yeah.
for the help.
I know one family who were all family members were positive, and they got the CT scan for the child also. I questioned them, why you did for the child? Okay, I understand it for the adults, but child not required. I said, because they
True.
simply exposing. And then I said, so I would request all the viewers that the decision of CT scan, please leave to your physician to decide.
Yes,
Don't decide for the kid.
absolutely. Yes,
Leave the decision.
absolutely.
Yeah, leave the decision to the physician. In case of pediatrics, I would say adults, I would not say, you definitely need to consult your physician before doing a CT scan.
Absolutely. The
And
CT scan is not, it's not
it's not a
because
diagnostic
it's not
test.
an, it is because it's not an invasive thing, and
Mm,
because you feel you can do it because you have the funds.
mm,
No, you're harming your whole system. And
mm,
for children, of course, I don't think parents will do it.
mm,
But even the pediatricians are guarded. But like I told you, that
mm,
now we are seeing children with post-COVID lung issues coming in.
mm,
So, you know, and especially the ones like us who are dealing with children with lung diseases.
mm.
So there we need to see, and because it's going to be a different line of treatment altogether. So that's not COVID, that's post-COVID complications.
Yeah. Ma'am, regarding the mask part, in less than 2 years, mask is not recommended. I think
Not recommended because it can be risky.
risky.
Because you see, you have to kind of have them under supervision,
Mm,
because you know, the child might just, the mask might slip, go into the mouth, and might just
mm,
choke.
mm, mm, mm,
So you know, you kind of invite in trouble. You know,
mm,
according to say WHO says, and UNICEF says that children less than 5 years don't need masks. No, no, that's not right. So
mm.
I think less than two
Less than
years
two years is not recommended.
accepted that you don't need a mask.
Mm,
More than that, children definitely need a mask, because now kids, how, I mean, where is the social distancing in a child? I mean, they play, they hug, they fight, they come close. Now, of course, don't send them. But when, say, you were telling me in UAE they have an option of going to the school or online. In
mm,
India, there has been no school for over a year.
mm,
And for class 8 onwards, it opened up for 2 weeks. And then again, the second wave started and it all shut down. So,
mm,
but when it starts, it is going to be with mask. It is probably be short hours, so that you're not taking down your mask,
mm,
you know, during eating or drinking water. So the mask has to be there, and maybe double cloth mask is okay,
mm,
or you know, a cloth mask. So what I say, in families where the child may be negative and the parents are positive, I say let him wear a cloth mask and then put a surgical mask,
mm,
and all of you and the parents can probably, you know, use a double mask or a N95 mask, because you know, this is till the child is found to be positive. But so double mask, because you see, if you just give a surgical mask to a child, it
mm.
can be loose. So
Lose.
the thing of a mask is it should cover the nose, it should cover the mouth, it should cover the chin, and it should be firm like that. It shouldn't be, hanging loose and you can feel air up from both sides thing. And even when you wear a mask, it's in these times it's better to use, a double mask, and a double mask can be two cotton masks, or you wear a cotton mask and a surgical mask. And see, when the first wave started, Swapnil, the N95 was swiped up by the general public, and
Mm,
we doctors didn't have N95. You
yeah.
know,
Mm,
before one could say Jack Robinson
mm,
N95, and it was 250 rupees,
mm,
300 rupees, but
mm,
we still bought it for our own safety.
mm.
And but now, of course, the N95 is available, cheaper, and the public, yes, uses it, but the health workers are getting their
So
N95s.
N95 also kids also can wear. That's it's okay for them.
And it's a mask which gives discomfort, right? If you use
Discomfort.
N95,
Yeah. Mm, yeah.
and N95 has to fit well. So
Mm,
if it doesn't, so grown-up children, yes, a 12-year-old can wear an N95. It
mm,
also, because they are like an adult size.
mm,
So, I would say anybody more than 30 kg,
mm,
is an adult size. And so
mm,
N95, it's not a N95. The N95 also has to fit well. If I
mm,
wear a N95 and if I'm wearing my specs and it's fogging, that
mm.
means my N95 is not firm.
Firm.
So, it has to be snug, tight fit.
Mm-hmm. Correct, ma'am. Yeah. We have a lot of viewers still sticking out because the session is very interesting, and I would
I'm
love
so
to hear
glad.
from. I would love to hear from the viewers how much value you found from this session. Just type in your comment box in the how much value you
And you
find.
tell me because I can't see.
Yeah, I
I
can
hope
see
that
that.
you're
Yeah,
enjoying
yeah,
and I hope,
yeah, 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 ma'am. Yeah, ma'am. Now, one question. I'll just take it in between.
sure.
Anything to boost the immunity, like Chawanprash in kids or anything? Your recommendation for this?
Moms and dads, it is not COVID. Through the child's life, you have to give them a nutritious diet. It should have protein, carbohydrate, fats, vegetables, fruits.
Mm,
So, COVID, one thing good that it has done to us is that we've discovered the value of nutritious food. So,
food.
there is less junk, there is less eating out,
Mm,
moms are cooking,
mm,
we've all become great home chefs. So,
mm,
now can you give Chavan now? If they ask me an innocent question like this, I would say it will not do your child any harm because it has a lot of amla, which is
mm,
vitamin C, which
mm,
is good. But remember,
mm,
Chavan also has arsenic. So
mm,
do not overdo it and don't kind of say two teaspoon twice because
mm,
my doc says it's good. So let me give it more in moderation. It
mm,
doesn't do
mm.
any harm.
The best part is now I see a lot of people popping up all these multivitamins, and they think that within
Yeah.
8 days our immunity will increase. But
Absolutely. So
immunity
this is
doesn't
what
increase like that.
absolutely. So this has made you realize that, when we said health is wealth,
Mm,
and yes, you would have some people who've come down crashing and who were fit and young and healthy, but
mm,
most of them have had some comorbids, obesity,
mm,
or a young person whose diabetes has been undetected,
mm, mm,
or just not eating healthy food, just eating packaged food. A
mm,
lot of young people, they would just eat. So now they know that cooking is not so tough because they managed to do it
mm,
without house help. And that, so vitamin C, so much about vitamin C.
mm,
Vitamin C, fortunately, now, Swapnil, I confess that do I write vitamin C? First of all, when they say, will you write something more, please?
mm, mm.
So I will
Correct.
write vitamin C because
Yeah.
it's water soluble. If the body doesn't need it, it will be thrown out.
Mm,
Now, zinc, they all know. Now,
mm,
with zinc, again, to young parents out there, zinc can also cause gastritis in a lot of children. So they
mm,
can have, epigastric pain,
mm,
discomfort and vomiting because of zinc.
mm,
So yesterday, like, a child of mine has gone to Hyderabad, and 3 days back they said that he's got fever. So I said,
mm,
has he come into contact with anybody who had COVID? He said his mama, but his mama recovered 2 weeks back. So I said,
mm,
I want the RT-PCR done. Until then, monitor temperature, monitor the saturation. Do you have a pulse ox at home? They said, yes, we have. And yesterday, the father sent me the RT-PCR, which is positive, which I knew would be positive. And then he said that, ma'am, shall we do a video consultation and you can tell us medicine? I said, your medicine remains the same, paracetamol. However, we will stick to our Monday schedule and you will send me his temperature and saturation. So this should send clean signals and clear signals is that we don't need any of this,
mm,
but your doctor's hands are tied too. A
mm,
lot of you feel that consultation means a prescription.
mm.
Consultation doesn't mean just talking.
Absolutely.
Consultation means they need a drug. A doctor needs a medicine.
Medicine.
So the medicine, let it be zinc and vitamins. So, but popping in your multivitamins just during COVID times is not good enough. Your food should be such that it has enough multivitamins on
Mm,
a daily basis. Your
mm,
food should be such. So, a family that I know very dear to me, and their food, I would always say, is very protein deficient. And whenever I would go, and they would say, "Oh, because you're a Bengali, and you just keep, you just think of." I said, "No, even your food, vegetarians can be rich in proteins.
yeah,
You
yeah.
can have tofu, you can have sprouts, you can have rajma, you can have chana.
There is a
It's just a
misconception that vegetarians have less protein. There's a misconception
yeah.
about that.
So
Yeah.
it's a myth. I said so. It's not because my food is, yes, it probably has more protein than a vegetarian diet, but vegetarian diet also has enough protein. So if you are going to be having a good protein diet, but like, to the mom who said Chavanprash, I think you've actually opened a can of worms for us to think. He said we've all realized that immunity depends on what goes inside us. So
Mm,
this was a wake up call. COVID 19
mm,
should make us give our children and ourselves good, nutritious food every day, day out, day. And an occasional junk treat is allowed because there has to be
mm,
some fun in life, isn't
mm.
it?
Yeah, correct. Ma'am. I absolutely agree with you that immunity part is depends on the food which you have and not dependent on the pills. And I will say that I will not discourage you to avoid all the pills at this moment. You take
Correct.
all the pills, but what is important is immunity has to be built over the period of time. It doesn't get built in 7 8 days. It has to be built over the period of time, because if you say vitamin, we are, or most of us are vitamin D deficient, and there's no harm in checking your vitamin D levels. And if your levels are low, definitely it is justifiable to take vitamin D. Even vitamin C, you can have we have a rich source, oranges, amla, which are rich source of vitamin C. We don't have in a
Just
regular
Nimbu
diet.
Pani, you
Yeah,
know,
yeah.
just Nimbu Pani. And vitamin D, you brought out a very good point, is
Mm,
that, you see, all of us are vitamin D deficient. Of course,
mm,
ideally, we should do the assay before, but we do see, vitamin D prescription now. If
mm,
I am writing vitamin D, and you see, and in a child who's never received vitamin D, I would probably
mm,
write the
mm,
sachet and say one per week for 4 weeks, and thereafter one per month. Now, this is very important for you to know. Vitamin D is a vitamin that has hypervitaminosis. Excessive vitamin D can harm you.
mm,
So you have to be, if you misunderstand your doctor's prescription, or it has been done in a rush, or it has been a verbal communication and not written,
mm,
then, and you are taking those vitamin D capsules every day, you can land into trouble, you and your child. So
mm,
it may be a good idea that when you are doing a video consultation, that the prescription should be written, even if it is something simple as paracetamol. The
mm,
dose has to be written. If
mm,
there is a vitamin, or if there is vitamin D or the zinc. You see, yesterday, this was really funny. that this a family had 32-year-old child, and they took I suggested, and then I wrote the prescription. And so the chemist said that this dose for a child is very high. And they panicked and they called me. And then I said, see, look, I go by weight. I don't go by a 6 year old.
Mm,
So your 6 year old is obese at 32 kg. So the weight, so the medicine dose is more than the chemist has seen a 5 year old or the 5.5 year old who is 32 kg.
mm,
So
mm,
this, my young friends who are watching there, COVID-19 has brought about a big issue in children. 80% of the kids have put on much more weight than they
wait.
should have,
Mm,
because there is no activity. They are like couch potatoes. The parents are busy with their work from home schedule. They are managing the household chores as well as their work. They are also the teachers, the online classes for 2 hours. But the teachers have given them prep and all, which will keep the mother busy for 2 hours, or the
mm,
father busy, whosoever takes the
mm,
work. And
mm,
so rest of the time they are so fed up that they are saying, okay, watch television. So the screen time, which we used to be so hyper about and say screen
mm,
time should not be more than 2 hours. Now their school online class is 3 hours. And then
mm,
the kid will say, you said for 2 hours, now 3 hours I'm there. My 2 hours is my session with my show.
mm,
So they are sitting and they are munching on their, junk,
mm,
and they 80% of them have put on more weight, and obesity comes with so much more problem. And
mm.
like I said, that
The risk
obesity is
factor.
also one of the comorbids of COVID-19.
Mhm. It's one of the important risk factors for COVID-19 because
It's a
I
risk
think
factor.
we have seen over the period of 1 year the kids have gained too much of weight because probably being at home.
Absolutely.
Yeah,
Being
and
at
there is
home,
less
not
of also
playing.
physical activity is also not there. So probably that is also hampering.
You see, going to the school, playing with friends, playing
Mm,
in the evening with friends, and now it is just sedentary,
mm,
and just eating a lot,
mm,
also, and mom's also cooking a lot. So it is kind of, they've all put on weight. So this is something that you need to. So this again, to all you young parents there, is that get with your children at home.
mm,
Play some music, dance together. You can teach them some exercise routine.
mm,
My daughter did something really innovative, and she would story tell while doing the Surya Namaskar,
mm,
about the various poses, and
mm,
got her kid to do it. And sometimes when he's yawning during a class, and she will say, okay, a little break, and come on, jump around. I think we have to involve ourselves a little bit more. You do not realize, like I now want to quote this, that UNICEF said that the children are not the face of this pandemic, but they are the ones who are going to have the
worst.
most far reaching effect. They're going to be the worst hit,
Mm,
because a child, say a 5 year old, doesn't understand what's happening. He's not going to the school, he's not going to the thing. So I'm giving from my own personal example. I would visit my grandson every month, and then every other month earlier, and then I stopped going. And then he said, why aren't you coming? I said, I will go once the coronavirus goes. And then when we all dropped our guard, and that was after September. So in October, we were all moving around a little bit. So I didn't fly, but I drove to him. And when I said, I'm coming to you, you know what he started doing? He started running around the house, and he says, coronavirus is gone, coronavirus is gone. My
mm,
bimbo is coming to me.
mm,
So, meaning it was like a spark to him that,
mm,
so I'm sure that is there in all kids, that what is happening, they can't express, and
mm,
it is very trying times for young parents I have seen people very close to me. Initially, it was the novelty of it. Wow, it's like homeschooling. We are loving it. We are
mm,
loving cooking for our children. We are
mm,
just enjoying it. It's family time.
mm,
Who knew then that it's not going to be 2 months, 5 months, 6 months? It's over a year. Now
mm,
the same mom is pinching the cheek, the same
mm,
mom is poking
mm,
because she is tiring. I
mm,
don't blame her. There is so much on her head. There
mm,
is so much. And the kid says, "You're not my teacher." They remember their teacher, but it's the mom now, it's dad now, so it is really trying time, and they can't express, they don't know what's happening. Adolescent,
mm,
see, for them nothing like their peer group
mm,
hanging out, talking about hormones surging in their body. They have so much to think. Here they can't talk, parents are all around, even if they are, so there is so much censored talk that they enjoy doing. Now,
mm,
do they need it? Yes, they need it. Their thing is, so they are coming with dysfunctional breathing. Now parents are coming saying that I think my child is having asthma. I said, well, what's happening? Says is breathing sighing breathing. So these
mm,
are actually dysfunctional breathing, which is we are seeing a lot in kids, and they're seeing wrong content on the TV. Kids are
mm.
seeing, deaths. They also probably know they're overhearing their parents talking about
Too much negativity around.
death, yeah, death in a family. They're discussing problems of work. Money may be a crunch, and this I'm talking about economically well-off families. What about the others? Like there are three kids at home and they have one gadget. Who's online? We were getting that free meal from school. Now they're not getting. We're only talking of a certain set, but
Mm,
children are really affected, and they're not sleeping well. Their sleep schedule has gone for a toss. They're having nightmares.
mm,
They're throwing tantrums by day. A
mm,
child with such a good schedule of sleeping at 8 and waking up at 6 is
mm,
now sleeping at 11 because he's
mm,
had this good 2-hour nap in the afternoon, because
mm,
the parents are okay that you sleep, I rest. So it
mm.
is trying times for all of us, but
Yeah.
please remember that children can't express. They don't understand a pandemic.
Mm,
Their world is turned up. They're bored of the toys. I know of a kid, the mother told me that I do you think I need a counselor because my child is weeing, is passing urine on the toys which is there. He goes to the corner, the toys are there. You know why? He is fed up of playing with those same toys. So I told the mother, put all those toys away. Explain to him that what is happening and maybe buy him one new toy, and thereafter you buy him another new toy after 2 weeks and
mm,
see how does he still pass urine on that.
mm, mm,
No, it stopped. He
mm,
just didn't know how to express boredom.
mm,
That the same thing I'm doing, it's the same zigzag, it's the same blocks, it's the same Lego. I don't want it. But he could not express it. So
mm,
once he passes urine there, his mother will say, now we can't play with that. It will probably do some craft work with him. And
mm,
this is what the child wanted. But
mm,
with the new toys, he settled down. So
mm.
every child has a different problem. So
Correct.
talk with the adult or with a friend who can help, talk with their own pediatrician. Everybody doesn't need a counselor.
Mm,
You can be your child's best counselor, but
mm,
understand them. But
mm.
take help of your own pediatrician because they know the unit. We are family doctors. We
Mm,
know that in a family, which is the Hitler parent and which is the
mm,
kind parent. Now, both the parents have become Hitler parents,
mm,
things go for a toss. Or
mm,
if both the parents have become overindulgent parent, now that also is.
mm.
So you have to find balance with your children.
Yeah, I agree with you, ma'am. Totally. The social and psychological impact is very much huge and humongous
It's
on the kids.
humongous. And
Yeah.
it's going to be a Swapnil.
Yeah.
COVID will go. Maybe we are thinking in another 1 2 years time COVID will go. Yes, there'll be a third wave, there may be a weak fourth wave, there may be a weak fifth wave. It'll
Mm,
go, it's not going to go in a hurry. It'll
mm.
become like the flu, like maybe we will take annual
Yeah,
COVID vaccine
vaccination.
just the way, and but the thing is, but these children now, I sometimes wonder that how will it be when they go back to school,
Mm,
when the school opened for 2 days,
mm,
for my grandson, and they just had an orientation to a new teacher because
mm,
they moved a new class, right? So the teacher needed to see. So they were just calling 10 children, and it was tough on the school. And this kid who used to love school was paranoid. He says, I don't want to go. But
mm,
when I asked my daughter that how was it, she says it may have been good. I didn't ask him much, but
mm,
he came back happier than when he went. Now
mm,
you see, these are robust, boisterous, happy kids who are behaving this way. What
mm,
about those introverted, shy ones?
mm,
How will they cope? How will the boisterous ones be? Would they become bigger bullies? So
mm,
it is good. How would the teacher be? Now they have just been online. How
mm,
would their world is going? How are they? Are
mm,
they going to be masked up and running? But they will be wearing masks. I mean,
mm.
how it's very grim. It's our generation is the only one that's seen the a
Mm.
pandemic, right? And
Yeah.
we are pandemic parents, and we are that our children are pandemic, our grandchildren are. So it's trying times.
The last question I want to take now, in regards to vaccination.
Yeah.
Now, the mass vaccination is started up to the age of 18 and above. In UAE, they gave an emergency approval for Pfizer vaccine from 12 to 15 years of old.
Yes.
In US also, they started, I think, they've given approval.
I think the first country was Canada. When Pfizer cleared its vaccine
Mm,
for 12 years and above,
mm,
Canada was the first country that
mm,
actually
mm,
bought up Pfizer for its children
mm,
12 years
mm,
and above. And
mm,
then I think very shortly US also did it. And I'm
mm.
so glad that UAE has
UAE
done
has
it.
also approved it, yeah.
Yeah,
Yeah.
that's wonderful.
I
And
think India part is still remaining. I think.
India part, but I want to share a very good news with you that
Yeah.
Covaxin, which
Mm,
is a Bharat Biotech and
mm,
your the ICMR project vaccine,
mm,
is actually, and it is an inactivated vaccine, has
mm,
started its phase 2, phase
mm,
3
mm,
trials from
mm.
2 years to 15 years. Now
Yeah.
that
Good.
is fantastic because you see, Pfizer has cleared for 12 years and above, but
Mm,
they have already started the trials for two
mm,
years and above.
mm.
So till our children are vaccinated,
Yeah.
do not think that all of us are safe. We are
Mm,
not safe. Yes,
yeah.
vaccine is, we have seen in this second wave. I know so many people who after 2 doses, be it vice Pfizer, be it the Covishield, they have come down with they have been RT-PCR positive, but none of them have got severe disease. And
Mm,
I just know one who needed admission, but not an ICU admission, needed a little bit of oxygen supplementation. So
mm,
vaccine helps.
mm,
Please register. Those of you who are listening from India, a lot of you would be in this 18 to
mm,
45 years age group.
mm.
It is not so easy, Swapnil, to get a slot, and
Yeah.
people are waiting for this slot. And even if you've got the disease, even if you've been RT-PCR positive and you've suffered with COVID, you should
Mm,
still take the
mm,
vaccine.
mm,
Maybe after a 2 months gap of
mm.
recovering from the disease, you definitely need to take the vaccine. And so I would think there is
Positive
good
news.
news,
Yeah.
yeah, on the vaccine front for children. But
Mm-hmm.
you see, we need to see the safety, and we also need to see the dose,
Dosage,
because
dosage.
you see the flu vaccine
Mm,
actually has different dose for children less than 3, and
mm,
it's not. a flu vaccine we don't give children less than 6 months, but
mm,
6 months to 3 years is one dose,
mm,
one kind of dose, and
mm,
3 years and above is the adult dose. And
mm,
similar even for hepatitis A vaccine,
mm,
which is of course not yearly, it is once in a lifetime. The
mm,
pediatric dose and the adult doses are different. So
mm,
they have to also work out on this. It's not just the safety, the effectiveness, because children have a different kind of an immune response.
mm,
And the fact that they are not coming down with COVID, and the fact that they have milder symptoms, so do they need a lesser dose? So they have to work out on all this. And the good news is that world over they realize the children have a right to the vaccine.
vaccine, yeah.
And
They
we
should be
pediatricians
vaccinated.
are really fighting about it, that our children need to be vaccinated. And we
Mm,
pediatricians who are vaccinating our children for so many diseases should be able to vaccinate the children when it comes through, and they don't have to go through the government, because it's
mm,
going to take that much longer. If we are safe enough to vaccinate them for so many diseases and so many vaccines, we
mm.
should be able to do it for COVID-19 too.
Yeah, that's the only thing left actually. If our kids are vaccinated, probably we can think later on to sending to schools. Probably that's the only
Yes,
only thing
you
we can
are
think of.
you are so right that
Yeah.
we can then harness our old life back. We
Mm,
can, send them to school. We can
mm,
let them play,
mm,
and who knows, we can also do little travels together as
mm,
families.
mm,
So, like normalcy is going to return back to our life. And at
mm,
this point of time, last year we said new normal. We
correct.
said, oh, it's the new normal. Now
Yeah,
the
ma'am.
new normal has become the normal.
Mm,
I want my old life back,
mm.
which I hope will soon be the new normal.
Definitely, ma'am. Definitely. I think Covaxin is in the phase 2 and 3 trial. They have given the approval. So probably we can
Yes,
expect they are saying by December. Let's
correct,
hope we get a vaccine at the earliest possible time.
for our
And
children.
let
Yes,
our kids get vaccinated the maximum, whatever is possible from a government side. And even that will be the only solution left at the moment because there's no other medications which can treat as of
nothing.
now.
There's no
Nothing. Yeah.
medication.
Yeah.
Nothing. All
Nothing.
these, there is no medication against COVID. They
Mm,
are medications which are there for severity and all. It's
mm, mm,
the symptoms.
mm,
It's the drop in oxygenation. It's the
mm,
pneumonia. They're treating all that. They are
mm,
not treating. There is no drug for COVID
mm.
19. So we should
Okay.
know that. So
Ma'am, thank you very much for this informative session.
thank
I
you,
think
Swapnil, for having me.
I think we can still continue, go and I think we have a time limitations also.
I
So,
know,
but
no, no. I'm sure. I'm sure.
I think still people are watching, ma'am, and they are very thankful. I think the one Meda who asked for Chamutra, she has thank you very much. She said, thank you very much, ma'am. She said for the
Thank you,
clearing that
Megha.
up.
Thank you.
Yeah. And thank you for all the viewers who have joined and you're still there at this moment. It is 1 hour 38 minutes. We are going with the continuous.
Oh, oh.
Yeah. And
When
still,
you told me, when you
I
told
told
me
you
1 hour,
1 hour. Now it's 1 hour 38 minutes, ma'am. Still, it was very informative, ma'am. It's very informative, and a lot of people must have cleared the doubts now. And I think surely it is. I would request all the viewers that share this video in your Facebook profile. Probably more people can get aware of this. And ma'am, looking forward for more sessions like this in future. And thank you very much, ma'am, for accepting
thank you.
this request
Thank
and
you.
clearing a lot of doubts. And thank you, Varun. And viewers, thank you very much for joining. And I
Yes.
would
Thank
say
you
that,
to the viewers.
yeah, stay safe. Okay, stay, keep
Yes.
social distances. Take care of your family. That is important at this moment.
Yes.
This pandemic will definitely get over. We have to be in a positive term because everything is. If you think positive, positive things will definitely happen.
Absolutely.
Yeah,
Absolutely.
and
Very
I
good
would,
message.
yeah. So think positive. Let's wait for the vaccination to come for the kids. That will be a very positive note, and it will
I
happen
want
surely.
to say something,
Yeah,
Swapnil.
yeah,
When
ma'am.
you put up the picture of the talk that we have today, I was very happy to see the child with a mask. So the
Yeah,
message is that still be masked, Like
Yeah.
Swapnil
Yeah.
said, social distancing, the
Yeah.
parties, get-togethers,
Don't
scaffold,
let your guard down.
and
Regardless of the,
don't let your. I think the second wave caught India off guard because
yeah.
we
Mm,
got overconfident and we let our
yeah.
guards
Yeah.
down. So we've learned from the mistake.
Yeah.
So
Okay, ma'am. Thank you very much, ma'am. And thank you for the
thank you
viewers. Good
very
night
much.
and take care, all of you. Thank you, ma'am.
Yes, thank you, Swapnil.
Thank you. Bye, ma'am.